Hi students, welcome to the new video in oral pathology. We are discussing skin lesions, right? So in this video, we will discuss about lupus erythematosus. Okay, so lupus erythematosus, I think you are all familiar with the lupus erythematosus. There are two types of lupus. There is systemic lupus erythematosus and discoid lupus erythematosus, SLE and your DLE, that is systemic lupus and discoid lupus, right? So, what is the main difference between, or what to learn in the systemic lupus and discoid lupus? Okay, so that is the question. Now, systemic lupus, as the name indicates, it affects multiple systems. Okay, it is a multi-system disorder. It's a multi-system disorder, while your discoid lupus is very much localized. Okay, localized. It is localized, and it usually affects your skin, the oral mucosa, etc. Okay, it will not affect much on the systems, but systemic lupus erythematosus can affect multiple systems. Now, what really happens in lupus erythematosus? In lupus erythematosus, there is an increased activity of B cells actually. Okay, your B lymphocytes and T lymphocytes. Your lymphocytes are what? Abnormal. They are acting abnormal. Okay, so what happens? They attack most of the blood vessels. Okay, they will attack vascular endothelial systems. Okay, endothelial systems, they can attack your renal endothelial systems, and most of the old endothelial system or vascular system are affected. So it is actually considered as a collagen vascular disease. Lupus is considered as a collagen vascular disease. Okay, vascular disorder. What happens here is that, what are the things you see? This systemic lupus erythematosus is usually seen in female population. Okay, so it is usually female are more common than males. Okay, females are more common than males. And what you see here, that when this lymphocytes, they attack the blood vessels in the face and all, you get vasculitis, and this blood vessel will appear more hyperemic, more reddish. So that's why they have the clinical feature, the famous clinical feature, that is a butterfly rash. Butterfly rash. Okay, or right, 10 is streaking bad. Butterfly rash or the malar rash. Malar rash. This butterfly rash or malar rash, can you see in this picture? Can you see on the malar region? You can see the red rash over the nose, and it is looking like a butterfly sitting on the face, right? So it's just a fancy name they have given. So this is the butterfly rash. Okay, butterfly rash or malar rash, which you see. Okay, and what else you see here is that they can attack your kidneys. There will be kidney failure. Okay, kidney failure is in, they will attack your heart and heart valves. Okay, heart valves. The heart valves, attacks, you see Liebman Sachs endocarditis. Okay, Liebman Sachs endocarditis. Okay, and in the oral cavity, mostly what you see in the oral cavity is that you can see that redness in the gingiva. There is erythematous in gingiva. There is ulcerations and erythematous gingiva. You can see in the oral cavity. Okay, so but in DLE there is no systemic symptoms. Okay, no system involved. Okay, no system involved. You cannot see anything. Only your skin and the oral mucosa is involved. And what you see in the skin is that on the skin you see some scaly lesions. Scaly lesions. Okay, or you can see some scaly lesions in the oral cavity. You will see gingivitis and ulcers, erythematous ulcers. Okay, so this the scaly lesions on the skin, when you try to pluck it out, if you try to pluck this out, you can see what some hair extension in this. Okay, so there is a scaly lesion, and if you try to pluck it out, you can see hair extensions below it. Okay, hair extensions below it, that is called carpet tract sign. Okay, carpet tract sign. Okay, carpet tract sign. That's not that important. So this is about the systemic lupus erythematosus and your discoid lupus erythematosus. Main difference, you should know that discoid is affecting only your skin and your oral mucosa. Okay, and there's one interesting question here. This is, can you see this cell? Can you see this? This is a feature you see in systemic lupus or discoid lupus erythematosus. This is called a LE phenomenon. Please note, LE phenomenon. What is LE phenomenon is that this in SLE or in lupus erythematosus, there is so many what new anti-nuclear antibodies. Okay, there is something called anti-nuclear antibodies, ANA. Means our own body is making some kind of antibody against the nucleus. Okay, nucleus or our own cells. So the nucleus of the lymphocyte, nucleus of the neutrophils, etc. are destroyed, and the other neutrophils will eat the destroyed nucleus. Okay, so can you see this here? It has it's there is this nucleus, these nucleus which I am marking in red. Okay, they are the original nucleus of that cell, but this is which I am marking in green, this one, that is a damaged nucleus which is eaten up by the cell. So a single cell has two nuclear material. A single WBC or single neutrophil, in the single neutrophil it has two types of nucleus. One is its own nucleus, which is normal nucleus, and the other thing is the remnant of the or damaged nucleus this cell has engulfed or eaten up. Okay, phagocytosed. So this is called LE phenomenon. Okay, LE phenomenon. This is seen in your lupus erythematosus. And what are the anti-nuclear antibodies? Please note the what are the different anti-nuclear antibodies you see. Please just remember the name. Anti-double-stranded DNA. Okay, anti-Smith, anti-phospholipin, and anti-cardiolipin. Okay, these are the four different anti-nuclear antibodies, and anti-double-stranded DNA is seen in the most common types. It is seen in 70% of the cases you see anti-double-stranded DNA. Okay, so this is about your systemic lupus erythematosus. Okay, see you in the next video with a new topic.